Straight Talk Foundation is a Ugandan communications and development non-governmental organization established in 1997. It operates nationally in Uganda. Its activities and interventions aim to improve the lives of adolescents in Uganda through the provision of quality behavior change communication programs. STF has grown considerably into an organization serving various categories of adolescent girls and boys. To date, STF has designed and implemented numerous programs to respond to specific population needs for health and development. This has entailed the adoption of evidence-driven strategies to respond to such needs. Straight Talk Foundation, with funding from International Planned Parenthood Federation of America, is implementing a project dubbed Closing the Gap, Phase 3 2018 to 2021 in northern Uganda within the districts of Gulu, Omoro and Kitgum. The project is implemented through 18 public and private health facilities, 13 public and 5 private, with an aim to promote innovation to sustain highly successful service provision and advocacy in Uganda within a more challenging global environment for sexual and reproductive health and rights for continuity of contraception services to women of reproductive age. In this project, there is much emphasis on establishing client flows in the health facilities to determine whether there is an increased health-seeking behavior among the community and whether there is sustainability of the project. Project objectives. Objective 1. With the support from Planned Parenthood Global, to strengthen the capacity of Straight Talk Foundation to be able to deliver in a continuous and sustainable manner quality sexual rights health services, particularly CSC and contraception services for women and young people. Objective 2. With the support from Planned Parenthood Global, to strengthen the capacity of Straight Talk Foundation to deliver culturally and age-appropriate information on quality and comprehensive sexual reproductive health to young people and women, and address stigma associated with abortion and contraception with the aim of increasing demand for, accessibility and utilization of services, particularly comprehensive abortion care and contraception.
This work has been on since 2015, and the focus was Northern Uganda, majorly looking at Acholi sub-region. We started in the districts of Gulu and Kitgum, but later on we continued to bring on board the district of Omoro. And when we started, of course, the main goal was to contribute to reduction of maternal mortality, and the main issue was providing quality facility-based family planning, but also an issue of post-abortion care services was very, very critical for this project. We thought it was very important for us to increase access to sexual reproductive health services among the young people, and especially women of reproductive age group. So we've worked a lot in that area since 2015. We've done a lot of work around health system strengthening. We've worked on issue of commodity security. A lot of the places where we worked in the facilities that we supported had an issue of stockout. The essential commodities were not available for family planning, but also for issues of post-abortion care. We looked at issues of data management. We know that data management is very important in decision making, but also we needed to create demand in the communities for both family planning and post-abortion care. But also there were a number of services that we needed to provide in terms of sexual reproductive health. So we've worked in about 18 facilities, both private and public, over the years from 2015. And there's been immense contribution in the work that we're doing.
Beginning with my staff, well, some of the changes, the positive changes are positive, has been the addition in skills skills provision in skills in service provision. Initially, Straight Talk used to deliver family planning services, that's true, but we used to do it at the static center here at our clinic and then the community. But with the coming of CTG project, there was a lot of training, a lot of resources was put in place to ensure that the skills of staff through QOC, clinical audit, mention it, and even use of machines and equipment, autoclave, all these. Our staff benefited a lot in terms of knowledge and skills in service provision.
It gave Straight Talk Foundation a better ground to train their staff to be in position to implement the project with quality. Because at first in the option of the project, some of the staff were not trained fully in relation to offer sexual reproductive health and rights. But when the project came, it brought that positive change to the STF staff, and they were in position to offer the services or the indicators that the project needs with quality.
It was very, very necessary. Some of these health workers or the service providers were trained way back in their school time, and so the project had an opportunity to really comprehend their services adequately, so we had to bring them, train them through the different family planning services we wanted them to take on.
Family planning is not a big challenge as far as issues of attitude is concerned. But though there are those who are from religious background, especially the Catholic, who do say we do not allow this hormonal or this artificial family planning. Let people do things naturally. Now, as a service provider, a healthcare service provider, you know that, for example, if a mother comes, this is a mother who gives birth almost after every 1 to 2 years. You have to have that one. So, family planning has not been a big one.
CTG has done a lot to the health sub-district. We had training. They trained a number of health workers from all the health center 3s and health center 4s, including the hospital. Then they also train the YPPs. These are people who are helping directly in the community to give the service. Then there was also mentorships which would be done every month to all these health facilities which are benefiting from CTG.
When we started, of course, working with the communities was a challenge. Access to family planning, there was a lot of negative attitude from the men. And a lot of the men would not allow their women or their young girls to go and access family planning at the facilities. So many times the women, we heard of stories when they would stick and go to the facilities. So we worked a lot with the men in changing their attitude.
Yeah, it was a day when I was back from my workplace. I got an information from home that there are some people who came here, who came to my village, who were teaching people on family issue program. So I had to get concerned that next time when they are coming, I should be there in person so that I learn enough from them. So the next day, the other day when they came, I was already informed. Then I waited until when I had the lesson myself with my fellow village members. They were teaching people on how to live a life just that people actually maintain the size of a maintainable family. How you can be with a woman and she doesn't conceive. Okay, in fact, from the village where we were taught from, we were as many guys as young people. We were so many, and of course, out of we who attended the lesson, we are doing well. I don't see anyone who is again conceiving anyhow.
In creating demand for family planning and the post-abortion care within the community, we worked a lot with the YPPs. And the YPPs, these we call the youth peer providers. We built their capacity to provide messages on issues of family planning, issues of post-abortion care, and generally reproductive health. We're able to integrate messages on prevention of teenage pregnancy. How do you seek for services amidst the stigma that was in the community? So we realized that we needed a group of young people that would relate closely with the community. So Our volunteers and workers in the field offices did a lot of capacity building training to ensure that the work was rolled out.
IUD and implant. Yeah, basically, as you asked me, this project has built my capacity regardless of handling adolescents, young and adolescents in sexual and reproductive health. And through knowledge in building my capacity as the youth peer providers has enabled me and impacted me with the knowledge of approaching adolescents who are really active in sexual and reproductive health, basically to bring them, because you know adolescents, they do enter in many problems. So regarding another CTG projects has built my capacities, I benefited a lot, myself and the communities.
Of course, when we work with the facilities, we noticed we needed to equip the facilities. The basic issues like lighting in the wards, in the maternity wards, was a big problem. So how do you ensure safe delivery when you don't have lighting? The essential equipment that was needed for insertion of methods of family planning were also missing. So we worked a lot with our partners to equip these 18 facilities, but also mentor the staff to be able to provide the services.
Straight Talk did a lot of things as far as the project is concerned. There was renovation which was done in some of the facilities, installation of solar to provide light in some of the facilities. Equipment was provided in some facilities, and construction of the youth center in some facilities.
There was installation of solar panels in the health facilities, like health center 3s and 4s, especially in maternity side, to help for deliveries as a backup power for them. Then they also provided sterilization equipment. Initially, the facilities were using charcoal stove, but then with CTG project, sterilizers were brought. We had gas, which all the facilities now were able to sterilize the equipment using gas cylinders.
Has contributed in closing the gap. Yes?
Yes.
The gap in capacity building, in reference to family planning, the post-abortion care, and long, and the lack. Yes. It has also helped us in improving the infrastructure in terms of solar in maternity, and then renovation of the maternity in Awach, Chwero, Badege, and Patiko.
And then the other thing also, which we benefited as a sub-district and as Health Center 4, is the support supervision. Yes. The project has been providing some resources for that purpose. Yes. And as a result, when support supervision is conducted, quality of service improved. Yes. So at the end of the day, quality of service in line with the family planning provision has improved.
Actually, I'm so happy and so glad, because I remember when I first joined in 2016, I was from a missionary hospital. I knew nothing concerning giving artificial family planning, the lack and the short term. But I'm so happy because actually the first month I came in, they have been taken for so many mentorship, and at least I'm happy I can now give, I'm able to reach the youth on both lack, especially ICD. I can also put all the family planning method and also perform the post-abortal care and CAC itself. So I'm really so happy.
did a lot of trainings of these health workers. They trained for us health workers on family planning provision. And this has also given a lot of input in the district in reduction of teenage pregnancies in the district. Initially, we were surpassing the national figure of 25%, but we were at 28.2% of teenage pregnancy. But at least because CTG project was there and the nurses and the health workers were trained, we managed to at least reduce to 25.2%, which is quite good, although we are still also beyond the national level. Yes.
The technical bit of it during the training enabled us to start providing the method which we were not providing in the past, like the lab. And also the CAC services we were not able to do, but after the training we were able to start providing the CAC services and the medical comprehensive care to our mothers. So most of the community members benefited a lot, especially the youth, because during the time they come from school, they are engaged in sexual activities, and as a result they need a medical abortion, and we're able to deliver the services to them. And also the youth, particularly, when they come, they engage into sexual activities. After giving them health education talk, they became aware that it was their right for them to access the family planning services. So we're able to give those services to our youth and also the community at large. Like in this region, as you see, fertility rate is very high. So in a family, you find a mother has delivered more than 7. Providing the family planning services enable us really to help the community members, and they appreciated it a lot.
Yes, to the beneficiary, the benefits of CTG project has been, one, access to services became very easy. We have different 9 locations where we have been giving services. You know, the straight talk office here, the different public facilities that we have in Gulu, and even the 5 private facilities that we added later on. So this enabled increase in access of services by young people and vulnerable women in the community. So as a result of that, the another benefit that we saw, a decline in teenage pregnancy.
By Straight Talk allowed us to look for people who could help to mobilize, and they were able to support them financially. So these VHTs and YPPs were able to move in the communities and talk to the clients and make them come. So that is how we were able to make them.
We've been carrying on one-on-one dialogues with clients. This helps to change or to convert them from short-term method to the long-term method.
Okay, first of all, we have this coupon like this Form B, whereby we have the names and where these people are located. And sometimes when I refer them, before the month end, I must go through all those things and I go one by one. At least sometimes when I meet them on the way, sometimes I meet them in churches, in the market, I first call that person and ask exactly how, maybe if she has got the services or not. Okay. That's how I was following, because there was some concern on transport, seeing the area is somehow wider. Okay.
Now with the community, we normally go there because when we have referred them, we make sure that we go up to their villages, because this community, we are working with them, we are together with them. I'm also coming from the community, they are also with me there, so they know me, I also know their places. So once we refer them, we make sure we go up to their homes, we follow, and we see the feedback, because there's a form where they take to the hospital, then from there the service providers sign there, they come back with it. So we find out where they have got the services on.
Sometimes I escort them up to the facility. Sometimes when they come to me, I give them referrals. After giving them referrals, I went to the midwife or this service provider from the hospital. I went and confirmed from them Sometimes I also call them whether the clients has reached them or not. That is how I was following what? Yeah.
Where the clients does not have a phone and do not know where to get the facility, to get the services, I was able to escort them to the facility and ensure that they have got the services they needed.
It was 2013 that I got my firstborn. She's now 10 years as I talk. Again, 2013, I got my second-born. Yes. No, 2010, my first-born. 2013, second-born. And I got a lot of problems that I'll share with you. So I thought of going to a nearby institution, that is your place, youth center. I got psychosocial support, that is counseling. And then another one, because I was already psychologically disturbed, I was made to interact with the fellow women that has really gone there to get services of that nature. Then the next one is, I also asked them if they could enroll me to one of the family methods, and I was done so. IUD. Well, I have got a lot of benefits. Number one, the lost energy that has gone when I really producing time and again came back. In that I was able to go back to the garden, do good work, and the best benefit was this year. I got gin at 45 sacks because I had all the energy compared to those days.
I get to know about this CGS because I read it from the signpost. Then secondly, I went inside, I saw a white tent with writings in it.
Okay.
That is the closing gap.
Okay.
Yes. I went, I found one of the workers there. I asked her about how to help me to space my kids. Then that person, she told me the various method of spacing. So she went as far as telling me dizzy, closing gap, pill plan, there is even this CDUs, then there is even this injector plan. But I've been using injector plan. It has brought some side effects in me. So I've decided to use the INT plan or the gaps closing. First of all, I have 3 kids, and out of the 3 kids, I want to first space so that I get time to plan for them well. My firstborn, she is 13 years.
And the last one?
My lastborn is 8 years.
8 years?
Yes.
So what benefits have you got as a result of using that method?
One, I was experiencing like 2 times menstruation. It has reduced it to the normal time. That is once a month. And it used to take 1 week when I'm in period. Now it has reduced it to 4 days. Secondly, I don't feel any side effect in me. I'm just free, as you see.
Yes, the problem is during my firstborn, I was operated. So I was told not to continue to immediately get pregnant, so I should abstain. So that way I learned to go to family planning. So she counseled me and take me for family planning. So I got the service so that I should space for some years. Yes. It was last year. Yes.
How old is your firstborn?
My firstborn was 7 years. And then the last one is 3 years. I have to. Yes, there is no problem. So I'm well. Yes, I can do anything. There's no problem. I'm staying well and I also eat well. Yeah, I do all things normal.
Our centers have remained open, and we've tried to observe the standard operating procedures, and we've had young people come in to access services, family planning services, and we've been able to talk to them about various issues. So in one or the other, we've learned a number of lessons that we're seeing how we can now translate these lessons into strategies that can be for the future. For example, our learning right now is that the young people will always need information. Just that time lag where we've not given information, where we've been curtailed, you're seeing a lot of gaps, information gaps about family planning, about sexual and reproductive health. Now that tells you that there's always a need for information. Even those that you've talked to, they need to be reminded. And so we need to think about continuity in terms of how do you make sure that there's always information going out to the young people. So we're trying to make sure that in terms of passing on information, as we've worked with the different people who are connected to the health facilities, who go out and take information, peer educators, talk about many of the other people within the communities that we've worked with, we will continue. That's a key strategy to make sure that information gets to the people. But also the other lesson is that in terms of attracting numbers, you need to be thinking about where you have, say like if you're working with young people, where you have the majority of young people that you can target at once. Okay? Talk about hotspot areas. Now, we're seeing that working with areas like universities, and of course universities the young people at universities are very, very vulnerable. And looking at, for example, in Gulu, the Gulu University and all those institutions around, those are very key and vulnerable young people. So it's important that you take the services nearer to them than waiting for them to come. For those that can come into the centers, it's important. I mean, it's good that they come. However, there are those that will not come to the centers. So the strategies are such that we've learned that you need to design and take services nearer to the young people so that they can then access the services. So we are seeing ourselves in the future as one of our future initiatives. Amplifying, I should say amplifying because we've already done it. We want to amplify that approach where we have services taken nearer to groups that we consider very vulnerable. Okay? Talk about sex workers. They need the services, they need the information. So again, those are also another group of people that we would want to make sure that they get the services. And so for the next 4 to 6 months, that is our focus. How do we maintain some of the activities? Of course, we've been working with and through the district. So, and then we've had also structures, community structures, like the YPPs, the CHWs, community health workers. Those are already structures on ground. So there's an aspect of continuity through some of those structures. So You might look at CTG ending, but it's not actually ending. The structures are there, and continuity will be seen.